There we go. Okay.
There you go, that's
There.
better.
Okay. So, first thing I do, introduce myself and explain what I'm doing. So, hi, my name is Johnny, and I'm going to be performing a health assessment on you today to overall find out your overall health, determine your overall health. So then I'll perform hand hygiene, make sure my hands are all clean, and then gather my equipment, which I have a pen light here, some scissors in case I need those, and then I got my stethoscope. So I guess the main thing with the head to toe assessment is it's exactly what it sounds like, a head to toe. And the best way to do this would be to go off this mnemonic that we have, which is intelligent nurses must check prescriptions religiously or regularly. So the systems I'll be going through is intelligent, so integumentary, nurses, neurologic, musculoskeletal, check, cardiovascular, prescriptions, psychosocial, and then religiously / regularly, which would be like your respiratory. So the first thing I'm going to do is start with your head and just go through the mnemonic. So I'm going to start with your integumentary system, starting with your head. So I'm going to look around like at your skin and see if I see any like lesions or rashes or anything. I might check your head up here to see if you have any scabs like on your scalp or anything.
I don't.
And then you can just feel around your neck, like your lymph nodes, just to if you got any swollen lymph nodes or anything. And then
Do I?
No, your neck feels okay. And then while I'm down here, I'm just gonna check your carotid pulse here, see if you got a strong, nice pulse, which I can feel it. It's pretty strong. And if I don't notice anything, then we move on to your neurologic. So what I'm gonna do for this is I'm just gonna shine this light to see if your pupils constrict, dilate right. See if everything is going good there. So I'm just gonna go here, and then I'm gonna look at that eye, and then I'm gonna do it again and look at this eye to see if it constricts the same way. Everything looks okay. I might ask.
Did you do this eye?
Well, you can just do one eye at a time, because they should both constrict regardless of where the light is.
But you only did one eye?
Right. It should just constrict regardless of where you shine the light.
Mm-hmm.
It should constrict on both sides the same way.
Oh, okay.
And then next, I might ask you to smile for me to see if your face is symmetrical and everything looks okay there. And then as long as you're talking okay, your speech isn't slurred or anything, which doesn't seem like it is, then we move on to musculoskeletal, which there's not a whole lot I can do with this. I might have you turn to the side to see if your jaw is okay. Anything out of the ordinary, like your cheekbones or anything protruding, but everything seems to be okay.
What about my back?
We get to that one later.
Okay.
See, intelligent nurses must check. So in your cardiovascular, I kind of already checked with that with the pulse or anything. There's not too much to check as far as the head goes. I guess if you look swollen or have any edema or swelling around your neck area or something, that might be an issue, but it doesn't seem like you do. And that's just something to check for. And then psychosocial, which again kind of goes back to how you're acting and your speech being slurred or whatever, which seems like you're here incoherent. I might ask you some questions like your name and where you are and stuff like that. And seems like you're all good there.
Okay.
And then respiratory again, as far as the head, it's not too much to address about that, but I guess
You have to hear me breathe?
yeah, we get to that as we're going down.
Okay.
But as far as the head, I kind of already or respiratory, we kind of already went through that with cardiovascular and stuff like that. It seems like we can just move on to torso area. So I guess if we had a bed, I could raise the bed up a little.
Mm-hmm.
But since we don't,
Am I in the hospital?
yeah, you're in the hospital.
Oh, okay.
we'll just start with the chest area. Again, like, it'd be nice to like have like a reclining thing, but we don't.
I can pretend.
Could pretend, yeah. We just kind of just sit up a little.
Okay, like this?
Yeah, that works.
Like this?
Yeah. Okay, so again, we start with like the integumentary, and since you're my mom, like I'm not gonna like do that. But I guess like you just check, like, so we're gonna be doing like chest and like arm area, I guess, now, because we're moving down from head to toe. So like I would just kind of like oversee your skin to see if you have any like anything wrong with your skin going on, like any edema or like swelling or maybe, I don't know, bruising and stuff like that, just to check. Everything looks fine, because I'm not gonna like do that.
Yeah, I don't have no bruising anyway, so
I might have to like do that later for listen to your heart, but like I'll make it work.
Okay. Go ahead.
Well, not yet.
Oh.
We'll get to that. And then just nurse. So the mnemonic intelligent nurses. So neurologic. So this is kind of like where I would ask you, like, can you feel like when I squeeze your fingers?
Mm-hmm.
And then can you push down my hands for me? Good. So that's kind of just like to see like if everything is working right the way it should be as far as neurologically.
Okay.
With your lymph and stuff like that. While I'm down here, I'm just gonna check your pulses too. Both sides, see if they're feeling good, which they are. So all is good there. Musculoskeletal, again, just looking for protruding. I might palpate down your arms a little just to like feel if anything is going wrong here, which everything seems to be okay. Maybe your shoulders up here. Everything seems fine. So intelligent nurses must check. So this is the cardiovascular portion. So I checked your pulses. They seemed fine. So now I'm just gonna like listen to your heart and lung sounds.
Okay.
From your chest.
Uh-oh.
So.
Uh-oh. I'm wheezy.
I know, it's just. Okay, I don't want to make this like too weird, but.
Go ahead.
Just breathe normal for me for now, and what we're gonna do is we're gonna listen, kind of like in a zigzag motion down, so I can get all parts of your heart and lungs. So just breathe normal for me.
I am. Uh-oh. I don't like that look.
Okay, so, now I know, like, maybe just like unbutton your shirt so I can like get to the lungs down here.
Oh, lungs. Okay, lungs are down here?
Well, like just underneath like the breast. This is just kind of where it's weird, but.
Okay. Wait a minute. Pull my shirts up. Okay, there we go.
I hope nobody laughs.
We don't want to be hanging out with the video. There we go.
Okay, so just go right under here and just take a couple of deep breaths. Good. Couple more. And then what I'm going to do here also is your apical pulse right over here. I'm going to sit here like for 1 minute. We won't do the full minute, but like on a regular head to toe assessment, I would sit here and count your apical pulse for 1 minute. Just do 15 and multiply it by 4. And when that's done,
What is my heart rate?
well, I didn't really have like an actual clock, but just for the purpose of getting checked off, that's just what you would do, is sit there and do it for a minute, for a full minute. Like you wouldn't do 15 times 4, but you would actually do a whole minute there on that side.
Oh.
Yeah. So your heart rate sounded okay, but of course since you've been smoking, like I heard some wheezing and stuff like that. But
I was a little wheezy. I told you I was wheezy.
Okay, so that would be like cardiovascular / respiratory. The other thing for respiratory would be like, I would kind of just like gauge your breathing, the way if you're like breathing heavy or breathing shallow, like I'd also note that and document that, which your breathing seems okay.
Mm-hmm.
And then psychosocial, like I said, that's like looking for anything like self-harm wise that you'd be doing to yourself, which you are not, so that's fine. So yeah, basically the point of that, the big one is to kind of like listen to all areas, listen to your lungs and hearts at the same
You don't
time.
need to take one of those things and knock my knee to see my reflexes?
No,
Oh,
do not.
okay.
Okay. So now like we addressed the torso / arm area, we would now move to the GI, GU, which is stomach.
Mm-hmm.
So then, like this is, I would have you like lay flat, like supine. So go ahead and kind of just like scoot down.
Okay. Nothing's wrong with my stomach.
Okay,
I
so
don't think.
again, integumentary, just looking at like your stomach, just seeing if there's anything, like if you have protrusion or just something like abnormal is in your skin area. Neurologic, I guess there's like not too much to do about like neurologic as far as the stomach area. Same thing, musculoskeletal, like it's kind of hard to like gauge what's like, since this is just mainly organs.
Wouldn't you like push on the stomach and just say,
Yeah,
does anything hurt? Like right,
Right,
there?
yeah, like you can, like palpate and kind of just like, that's the main thing, like I guess you would do when you're like listening, is kind of just like, you know, palpate and asculate and stuff like that to see if like anything is wrong. Let's see, intelligent nurses must check. So cardiovascular, again, like there's not too much to go about cardiovascular. This is just like your GI system. And then psychosocial.
You have to listen to my stomach?
I do. I'm just going through the mnemonic.
Oh.
Make sure I hit all the points. Psychosocial, just looking for anything self-harm wise or whatever that you could be doing to yourself. And then respiratory, again, there's not too much to go about that. So the main thing about this area would be to just listen to your stomach in all 4 quadrants. And then again, like you said, kind of like, you know, if I see something or like hear something wrong, like maybe palpate and like kind of like ask, do
If
this.
it hurts, yeah.
Yeah, to
Okay.
figure that out. So I'm just going to listen. So the main thing with this is like you want to listen to all 4 quadrants, like in a clockwise motion.
Mm-hmm.
So I'm just going to do that real quick. So just read normal. Sounded good. I guess the other main thing, since like mnemonic doesn't like apply to a whole lot for your like GI system, is like you would just ask them questions like, when was your last bowel movement, and like what was the consistency, like are you having any constipation,
Nope.
are you having any pain
Nope.
going, like any diarrhea, same thing
Nope.
with like urinating, any
Nope.
like pain,
Nope.
everything is coming out okay, like what's the color consistency type questions. So everything sounded fine to me. So that's like the main thing at the GI GU system. So then now we would move on to the legs, and again, like integumentary, just kind of looking at the skin, seeing if anything is out of the ordinary.
I
You're
have a
lo-
crinkle toe.
You do have a crinkle toe, so getting down to that, I guess I would have maybe ask you if it's always been that way or whatever.
Nope.
It's not always been that way.
What is it?
What is it?
Yes. It's a big bone sticking out, it looks like. Can
Well,
you take it off of there?
I cannot take that off of there.
What is it?
It kind of just looks like some deformity in your toe bone.
Ooh, that hurts.
Does that hurt when I push
No,
it?
it just feels weird.
Okay. So long as there's not any pain there, I guess I would document that.
What is it, though? Do you know what it is?
Do I personally know? No. It just kind of looks like some sort of protrusion in your toe bone area.
Yeah.
I guess just some sort of
I wonder what
deformity.
it is.
So that's
it
part
looks
of
like a witch toe,
a little.
don't it? It just sticks out. Look it.
Right.
I wonder what that is.
I couldn't tell you for sure.
Okay.
But moving on. So yeah, just addressing that would be part of the musculoskeletal. So like I would just palpate down the legs, and then when I got to your ankle/toe, I guess I would have been like, you got something going on with your toe there.
Just something going on with my toe.
So as far as neurological, I would definitely squeeze your toes. Can you feel that?
Yeah.
Can you push down with your feet for me? All good there. And then like you have pulses here. So I'm going to feel pulses. So there's a pulse right in here between your big toe and your, I guess, middle toe here. And I would just feel them to see which I can feel in right now. Some strong little pulses. And there's also some behind your knee, which one's kind of difficult to find, but it's right here in between the crinkles of your knee. Just make sure you have pulses there.
Right.
Yeah.
I do? It's okay.
So then we went through neurologic, musculoskeletal, we addressed the toe thing. Intelligent nurses must check. So cardiovascular / respiratory, let's go ahead and get that out of the way. It's like, again, any edema would be coming like from your lung / heart. So like swelling in the feet, kind of like Todd. Remember when Todd had that?
Yeah.
So I would definitely look for like swelling in the feet or anything like just out of the ordinary in that area, and then psychosocial, like see if you have like any scratches, bruising, or anything that you might be doing like self-harm towards.
No.
And then at this time, since we didn't get like listen to your back earlier, I can ask you to like
Roll over.
roll over,
Okay.
and I can just listen to your back if
Okay.
that's okay. So then
Gotta take off my shirt.
I can listen to your lungs in the back. Just take a couple of deep breaths for me. Okay. And then at this time, like I would just like look over this area, just like I guess the butt and like the back of the legs and just anything on the back, like even up here on the neck or whatever, just to see if you have anything like out of the ordinary there, like just a gauge, just to see, you know, if everything looks normal. Which we're assuming it is because you're my mom.
Okay.
I'm gonna address you. And that's really about it, as far as I can remember. So we're gonna go with that.
Okay.
I guess the main thing I forgot to say in the very beginning was I would like, after introducing myself and stuff, like I would get your name, date of birth for identifiers, and then I would like check your vital signs then, like blood pressure, temp, pulse ox, and height and weight, and just get like a general like medication history and overview.
Oh, right, right before you started that.
Before I started, yeah, I forgot to mention that, but so I don't like forget the points.
Okay.
But yeah, that would complete.
You have to check my wristband, make sure it's me.
Right, so that's like name, date of birth,
Right.
with the wristband. And that pretty much completes the head to toe. And then, I suppose if you have any questions for me before a doctor comes in, or
No, just my crinkle toe.
just your crinkle toe.
Yep.
But, yeah, that's about it. I appreciate you being my person.
Thank you.
You're welcome.
Okay, find out what that is, though.
You'd have
Look,
to go.
show it in the video.
No.